In this media, you will learn about first aid. First aid. Some of the common health problems for which first aid is given on board ships are breathlessness, unconsciousness, and so on. It is necessary to help the patients immediately without abandoning them. ABC. Air, breathing, and circulation is the abbreviation of ABC. It is an important first aid method. Air. Make the patient lie on the flat surface and provide space for airflow. Make the head bend backwards. Breathing. Begin resuscitation with 3 to 5 breaths when the patient is not breathing. Pocket mask can also be used. Check the neck pulse by holding the neck backwards. Continue resuscitation with 12 breaths per minute if the pulse is felt. Circulation. Knock the heart powerfully for 2 to 3 times when no pulse is felt or paleness is seen. If this method does not work, begin external heart compression every 1 second. When first aid is given properly, the chance of recovery is more. Thus, you have learned about first aid. First aid box. You should have the below list of items in your first aid kit. Tapes. Bandages. Butterfly bandage. Ointment. Scissor. Gauze. Safety pins. Surgical blades. Burn aid gel. Antiseptic towelette. Elastic bandage. Sterile water. In this media, you will learn about the skin. The largest breathing organ of the body is skin. It forms the boundary or covering for the body from the environment. The surface of the body is covered by the skin, just like an impenetrable protective film. There are various tissues with different qualities in the skin. It is also a significant sensory organ. Thus, you have learned about the skin.
In the following media, you will learn about the heart. The heart is placed in the chest cavity. The lower portion of the heart is tilted slightly towards the left. The size of the heart is about the size of a fist. Closing your fingers in the direction of your palm will create a fist. The heart is divided into 4 chambers. The upper 2 chambers are termed as atria, which is called the atrium. The lower 2 chambers are called the ventricles. In the heart, circulation of blood starts from its right side. The blood is transported from the heart to the lungs and flows back into the heart. The heart pumps this blood to other parts of the body. Thus, we have learned about the heart. The human heartbeat occurs in 3 steps. In the first step, diastole occurs. Here, both the atria and the ventricles are in a relaxed mode. During atrial systole, the ventricles are relaxed. And during ventricular systole, the atria are relaxed. During diastole, the blood flows passively into the atria. Initially, the atrioventricular valves are closed. But as the atrial blood pressure increases, the valves are forced to open and blood flows into the ventricles. The semilunar valves remain closed during this phase. In the second step, or atrial systole, the atria contract simultaneously and force more blood into the ventricles. The third step, ventricular systole, begins as soon as the ventricles start to contract, causing an increase in blood pressure. When the blood pressure increases in the ventricles, the semilunar valves are forced to open. The atrioventricular valve snaps shut. and the atria begin to relax and refill with blood. As the ventricles continue to contract, causing the blood pressure to increase even more, the blood is pushed into the aorta and the pulmonary arteries. From here, the blood flows into the other vessels. The ventricles now relax, causing a decrease in pressure, which allows the semilunar valves to close. Another diastole will now begin, and once again, the heart starts pumping blood. The heartbeat occurs about 72 times per minute. A specialized cell located in the right atrium near the superior vena cava is called the sinoatrial node. A small mass of tissue situated in the wall of the atrial septum is called atrioventricular node. At the upper end of the ventricular space, the AV node is separated as right and left atrioventricular bundle branches. Each bundle branches have the breakup into fine fibers called the Purkinje fibers. It will take 0.1 seconds for receiving impulse from SA node to AV node. In the meantime, it finishes the contraction of atria. The AV node conveys the electrical impulse to the apex of the myocardium via the bundle branches and the Purkinje fibers. The blood is pumped out of the ventricles when the wave of ventricular contraction begins. In the following media, you will learn about the arteries. The blood vessels have two main types. The lungs are packed with a rich supply of oxygen when you inhale fresh air. Oxygen is distributed all over the body from the heart. The blood carries carbon dioxide and other waste materials to the heart. In order to remove the carbon dioxide from the body, the heart carries it to the lungs. One type of blood vessel is called the artery. It carries blood away from the heart and distributes to the rest of the body. The arteries are made of thick elastic wall in order to support the rapid flow of blood at high pressure. The flow of blood through the arteries can be studied by performing an activity. By holding your left wrist with the index and middle fingers placed on it, throbbing movement is felt. A pulse is defined by these throbbing movements. The movement of blood into the arteries generates the pulse. The number of pulses in the arteries per minute is called pulse rate. The pulse rate for a resting person is between 72 and 80 pulses per minute. There are other places in our body that exhibit a pulse. Thus, you have learned about the arteries. In the following video, you will learn about veins. Veins are another type of blood vessel. They are thin-walled with a large lumen which permits the passive flow of blood towards the heart. They usually transport deoxygenated blood to the heart. The blood can only flow in one direction due to the presence of valves that help prevent backflow when closed. The pulmonary veins are exceptions as they carry oxygen-rich blood to the heart. Veins help the blood flow through tissues. The veins originate at the sites of capillary beds. They return the blood into the heart. Thus, you have learned about veins. Cholesterol is a natural substance found in foods, and it is created by our body to help build and maintain ourselves. Too much of cholesterol can lead to major problems like heart attacks and stroke. This happens when the amount of cholesterol in our diet plus the natural cholesterol made up inside the body add up and the total level goes too high. Our body naturally makes cholesterol in the liver, and the body also gets cholesterol from the food we eat. This cholesterol gets digested in the stomach and moves to the small intestine and then enters the blood. When there is too much of cholesterol in the blood, deposits constructive form inside the arteries. This is a serious problem because over time those deposits can grow and restrict the flow of blood to the vital organs. A blocked artery in the heart causes heart attack, and a block in the brain causes stroke. It can be prevented, controlled, and reversed by changing the lifestyle pattern, diet, and medical prescription. In this media, you will learn about how we breathe. We all know that we inhale and exhale air through our nostrils, and then the air reaches our lungs. To understand the mechanism of breathing, it is important to learn the anatomy of lungs. Let us observe the structure of our lungs. You can see that our lungs are placed in the chest cavity. The windpipe connects the nasal cavity to the lungs and helps in the passage of air. The lungs are well protected by the rib cage, which surrounds the lungs on sides. You can see that the diaphragm, a large muscular sheet, forms the base of the chest cavity. The rib cage and the diaphragm play an important role in the mechanism of breathing. Let us understand the mechanism of breathing. We inhale air through our nostrils. This air then It is important to learn the anatomy of lungs. Let us observe the structure of our lungs. You can see that our lungs are placed in the chest cavity. The windpipe connects the nasal cavity to the lungs and helps in the passage of air. The lungs are well protected by the rib cage, which surrounds the lungs on sides. You can see that the diaphragm, a large muscular sheet, forms the base of the chest cavity. The rib cage and the diaphragm play an important role in the mechanism of breathing. Let us understand the mechanism of breathing. We inhale air through our nostrils. This air then passes to the lungs with the help of the windpipe. Breathing involves the movement of rib muscles and diaphragm. During inhalation, rib muscles move up and expand outwards, while the diaphragm moves downwards. This combined movement of rib muscles and diaphragm increases space in the chest cavity and allows airflow. During exhalation, rib muscles move down and contract inwards, while the diaphragm comes to its normal position. This contraction of rib muscles and movement of diaphragm results in the reduction of space in the chest cavity, and thus air is pushed out of the lungs. If you keep your hand on your abdomen for a few seconds, you can feel the movement happening during inhalation and exhalation. The air that we inhale has many unwanted components like smoke, dust particles, pollen, grains, etc. Sometimes while breathing, some particles get stuck in the hair follicles of your nose. These cause irritation in the nose and result in sneezing. Smoking damages lungs and may also cause cancer, hence, we should not smoke. Thus, you have learned about how we breathe. Human respiratory tract consists of nose, mouth, pharynx, larynx, and trachea. Followed by these organs, trachea has carina. The trachea is further separated into upper and lower lobar bronchus at both left and right side. This is another view of morphology of respiratory tract. The trachea, left lung, pulmonary blood vessels, and heart are the visible parts. The lungs consist of right, left, upper, middle, and lower lobes. In the following media, you will learn about digestion in humans. Human beings ingest food through the mouth. The food is then digested and transported to the organs in the body. The undigested components of the food are eliminated. Food entering into the mouth moves through a continuous passage called the alimentary canal, which is also called the digestive tract. The alimentary canal starts with the buccal cavity, esophagus, stomach, small intestine, large intestine, rectum, and ends with the anus. As the food passes through the alimentary canal, it gets digested. The internal walls of the stomach and small intestine secrete digestive juices. Organs like the liver, pancreas, and glands like salivary glands also secrete digestive juices. Digestive juices make the digestion process easier by breaking down the large complex food into smaller components. The alimentary canal and the glands related to it form the digestive system. Thus, you have learned about digestion in humans. Primary function of the digestive system are the breakdown of food and absorption of nutrients. The breakdown of food is called digestion. In mouth, food is broken down into smaller pieces through a process called mastication. It results in formation of food bolus. Salivary glands located near oral cavity secrete saliva. It begins chemical digestion. After mastication, food is swallowed. The soft palate prevents food from entering the nasal cavity. Food particles are pushed through the pharynx to the esophagus. The esophagus connects the pharynx to the stomach. Food bolus enters the stomach. Stomach cells secrete hydrochloric acid. Chemical reactions of enzymes like pepsin digest food bolus. Bolus is further broken down by muscular contractions in stomach. It mixes up with secretions to form a thick liquid called chyme. Bile from liver and enzymes from pancreas empty into duodenum to digest chyme. Microvilli of jejunum and ileum absorb nutrients into blood and lymph. Water and mineral salts are absorbed in colon. Undigested material will be eliminated from body through the anal opening. In the following media, you will see an activity on functions of saliva. Take two test tubes and name them X and Y. Pour 1 spoon of boiled rice in test tube X. Chew another spoon of boiled rice for 4 to 5 minutes and pour it in test tube Y. Pour some amount of water in the two test tubes. Add a drop of iodine solution in both test tubes. The color of boiled rice in test tube X turns to blue. This is due to the presence of starch. The color has not changed the other test tube because the starch is broken down into simple sugars by the saliva. The floor of the buccal cavity has a boneless, muscular organ called the tongue. It performs many functions. It is mainly used for talking. It helps in mixing of food and saliva. The tongue contains taste buds, which aid in tasting the different flavors of food. Thus, you have seen an activity on functions of saliva. In the following media, you will see an activity on position of taste buds. Make 4 solutions using sugar, salt, lime juice, and juice of bitter gourd. Close one of your friend's eyes with a cloth and tell him to show his tongue out in a flat posture. Put a drop of each solution one by one using a toothpick in different areas of the tongue. Now, tell your friend to identify the locations where he can feel the different tastes in the tongue. Note down the observations and perform this experiment with other friends. Thus, you have seen an activity on positions of taste buds. In the following media, you will learn about the mouth and buccal cavity. Food is ingested through the mouth. The method of acquiring food by the body is called as ingestion. The food entering the mouth is chewed by the teeth and broken down into smaller pieces. Separate sockets are allotted for each tooth in the gums. Teeth have different functions and shapes. They are named correspondingly. During childhood, a set of teeth grows and falls out. These are called milk teeth. These teeth then are replaced by another set of teeth called permanent teeth. Permanent teeth last for our lifespan. It may fall out at old age or due to some disorder in the teeth. Thus, you have learned about the mouth and buccal cavity. In the following media, you will learn about the food pipe or esophagus. Food is chewed in the mouth. Then the food enters the food pipe or esophagus. The food pipe starts at the pharynx and ends at the stomach. The movement of the walls of the food pipe pushes the food down. Food is pushed all over the alimentary canal by this movement called peristalsis. If the food is rejected by the stomach, it is immediately expelled out. Thus, you have learned about the food pipe or esophagus. In the following media, you will learn about the stomach. Human stomach is like a bag and has thick muscular walls. It is in the shape of a flattened U. It is broader than the other parts of the alimentary canal. The food is pushed into one end of the stomach by the esophagus. The stomach then pushes the digested food into the small intestine through its other end. The lining inside the stomach releases mucus, hydrochloric acid, and other digestive juices. The mucus shields the lining inside the stomach. The acid destroys the harmful microorganisms present in the food. The secretion of such acids into the stomach helps in maintaining an acidic medium that prevents bacterial growth. It also aids the juices in the stomach to act upon the food. The digestive juices reduce the complex protein components into simpler forms. Thus, you have learned about the stomach. In the following media, you will learn about the small intestine. The small intestine is 7.5 meters long, and it is extremely coiled. The pancreas and the liver secrete juices into the small intestine. The walls of the small intestine also secrete juices. The liver is a gland which is located in the upper portion of the abdomen on the right side. It is reddish-brown in color. The liver is the largest gland in the body. Bile is secreted by the liver. The gallbladder is a sac-like structure which stores the secreted bile. The bile is used in the digestion of fats. The pancreas is situated beneath the stomach. It is large and cream in color. The juice secreted by the pancreas breaks down the complex carbohydrates, fats, and proteins into simpler components. The stomach partially digests the food and pushes it into the small intestine. The intestinal juices in the small intestine act on the food and complete the digestion. The carbohydrates are broken down to glucose. Triglycerides are digested to fatty acids and glycerol, and the proteins are broken down into amino acids. Thus, you have learned about the small intestine. In the following media, you will learn about absorption in small intestine. After the digestion is complete, the blood vessels present in the walls of the small intestine receive the digested food. This method is called absorption. The internal walls of the small intestine consist of finger-like projections called villi. They help in increasing the surface area while absorbing the digested food. Each villus has a set of thin and small blood vessels near its surface. The digested food is absorbed by the surface of the villi. The blood vessels transport the substances that are absorbed to various parts of the body. These absorbed food components help in forming the complex components like proteins. This process is known as assimilation. Aerobic respiration breaks down the glucose to carbon dioxide and water and releases energy. Thus, you have learned about absorption in small intestine. Liver is unique in the multiplicity of functions performed such as metabolic, storage, synthesis, detoxification, and erythropoiesis. It participates in maintenance of constant blood glucose and in production and storage of glycogen. Liver is the site for synthesis of cholesterol and phospholipids. Another important function of liver is production of various substances like blood clotting factors. Oxidative deamination of amino acids results in the formation of ammonia. The toxic ammonia is converted to urea in the liver and excreted in urine. Vitamin A, D, K, and folic acids are stored in the liver. Bile is secreted by the liver. It is necessary for the emulsification of fat during digestion. Liver detoxifies alcohol, drugs, and toxic substances. It converts fat-soluble to water-soluble substances and excretes them in bile or urine. Liver produces all blood cells during the 2nd to 5th month of intrauterine life. Prothrombin is a protein that helps in blood clotting. Prothrombin is formed in the liver. The normal time needed for the blood to clot is between 10 to 15 seconds. A prothrombin test measures the time taken for the person's blood to clot. When the person is given food containing vitamin K, the absorption of vitamin K takes place in presence of bile. The vitamin K enters into the liver. Prothrombin is formed in the liver and helps in the formation of blood clot in normal condition. In obstructive jaundice, only little absorption of vitamin K takes place due to the absence of bile. So there is no formation of prothrombin in liver and it leads to bleeding. In liver cell damage, little prothrombin is formed in the liver and it leads to bleeding.
First aid for a cardiac arrest. Cardiac arrest is when a person stops breathing and the heart stops beating. The preliminary step for the first aid is shown in the animation. Tap the victim on the shoulders and shout, "Are you okay?" Simply place your cheek just above the victim's mouth and nose. Look for the chest rise. Listen and feel for breathing for no more than 10 seconds. If no breathing, begin CPR. 30 chest compressions and 2 breaths. Repeat this cycle 5 times, which is approximately 2 minutes. Recheck for breathing. If no breathing, continue CPR. If breathing is present, roll victim on his side to protect his airway. Attempt to have a new rescuer performing CPR every 2 minutes as rescuers tire. Always have the victim on a hard surface, not in a bed. Compressions should be at a rate of 100 to 120 per minute. Each breath should be just enough to create some chest rise. Each compression should be 2 to 2.4 inches deep. If initially, when you breathe for the victim, the air does not go in, retilt the head and continue to hold it all the way back to be sure the airway is completely open. Try breathing again. If the air does not go in, the airway is somehow blocked. Perform CPR. However, each time before you breathe, look in the mouth. If the mouth is empty, try giving a breath. If a foreign object is visible, scoop it out. Then try again to give a breath. Victim may never regain consciousness. Proper positioning of hands on sternum. Use middle and index fingers of your lower hand to locate the lower edge of the victim's ribcage on the side closest to you. Slide your fingers up the ribcage to the notch at the end of the breastbone. Place your middle finger on the notch and your index finger next to it. Place the heel of your other hand along the midline of the sternum next to your index finger. Chest compressions. Place the heel of one hand directly on the sternum and the heel of the other on top of the first. Position your shoulder overhand with elbow locked and your arm straight. Give 30 compressions. Each should compress the chest about 1 to 1.5 inches at a rate of 80 to 100 compressions per minute. The animation gives instructions on cardiopulmonary resuscitation for child or infant. Tap the victim on the shoulders and shout, "Are you okay?" Simply place your cheek above the victim's mouth and nose. Look for chest rise. Listen and feel for breathing for no more than 10 seconds. If no breathing, begin CPR. 30 chest compressions and 2 breaths. Repeat this cycle 5 times, which is approximately 2 minutes. Recheck for breathing. If no breathing, continue CPR. If breathing is present, roll victim on his side to protect his airway. Attempt to have a new rescuer performing CPR every 2 minutes as rescuers tire. Always have victim on hard surface, not in a bed. Compressions should be at a rate of 100 to 120 per minute. Each breath should be just enough to create some chest rise. Each compression should be 2 to 2.4 inches deep for a child. For infant CPR, compress the chest 1.5 inches deep with 2 fingertips, just below the nipple line. If initially when you breathe for the victim, the air does not go in, retilt the head and continue to hold it all the way back to be sure the airway is completely open. Try breathing again. If the air does not go in, the airway is somehow blocked. Perform CPR. However, each time before you breathe, look in the mouth. If the mouth is empty, try giving a breath. If a foreign object is visible, scoop it out, then try to give a breath again. Victim may never regain consciousness. Choking occurs when a person cannot cough forcefully, speak, or breathe. There are different ways to clear the choking with the help of a person or when the person is alone. If a person is there for help, then abdominal thrust can be used. The responder stands behind the victim. He places the 2 hands around the victim from his back to the front over the abdomen. He makes a fist with one hand and grasps it with the other hand. He then moves his fist in an inward and upward motion continuously till the choking is removed. If the victim is alone, then he can place a pillow on a chair and place his abdomen over the pillow. Then he should bend upward and downward as shown until the object is removed. First aid for heavy bleeding. This animation gives instructions on first aid and the skills to stop the heavy bleeding. Some of the control points that control the continuous blood flow from the heart to the other parts of the body through arteries are shown in the figure. Applying pressure on these points with the thumb will reduce the blood flow to the wounded area. If there is a wound in the arm or leg, first cover the bleeding area with a gauze, muslin bandages, clothing, or cravats. Then, wrap a cloth around the arm or leg above the wound and put a half knot. Place a stick or rigid object on top of the half knot and tie a full knot around it. Then, Twist the stick until the cloth tightens and the bleeding stops. Then, find a place to get the medical aid. First aid for burns. This animation explains the preliminary steps for treating burns. Cool water is poured over the closed burnt area to remove the heat and to stop the burning process. Be careful not to make the victim hypothermic, cold. Any blisters should be left closed. Do not break the blisters. Any open burn, burn with charred skin, and any burn to the face, hands, feet, and genitals must be seen by a doctor. The injured area is covered by a clean cloth. In this media, you will learn about fire injuries. When treating fire victims, time is of the essence. It is necessary to aid them quickly. Patients must be kept in the stable lateral position. Supply of oxygen is critical. Cool their body quickly for minimum 20 minutes. But do not freeze them. Examine the level of injury. Warm blankets, fluids, and rest is required. Pulse rate must be checked often. Thus, you have learned about fire injuries.
In this media, you will learn about fractures and sprains. Signs and symptoms of a fracture are: 1. Pain at the site of the wound that increases with movement. 2. Difficult or impossible to move the affected part. 3. Swelling and bruising of the affected area. 4. Deformity at the affected site. 5. Presence of shock. General first aid to a fracture. 1. Check the DRABC. Danger, response, airway, breathing, and circulation of the victim. 2. Control the bleeding first before immobilizing the fracture. 3. Prevent movements of the fracture sites. 4. Support the fracture with enough padding. 5. Do not push the bones back in. 6. Provide enough padding before shifting the victim to the hospital. 7. Control swelling and pain by applying ice pack to the affected part. 8. Try to prevent shock. Making a splint. 1. The rules of splinting are: A. Stabilize the fracture above and below with your hands. B. Check motor and sensory functions on the affected limb. C. Immobilize the limb. D. Recheck motor and sensory to be certain you have not splinted too tightly. E. Transport the victim. 2. Ice packs are never applied directly to the skin. This can damage the skin. Always have a cloth between the ice pack and the skin. 3. Prevent shock by having the victim lay down if he can, and keep the victim warm.
In this media, you will learn about bones, joints, and soft tissue injuries. For bones, joints, and soft tissue injuries, the best first aid treatment is ICE method. ICE stands for ice, compression, and bandage and elevation. ICE. In order to reduce the temperature of the injured area, it is good to ice the injured area. This helps in the reduction of bleeding in the underlying tissue. There will also be a reduction in pain and swelling. Compression and bandage. If icing is not very effective, the next method to be followed is compressing around the injured area. The pressure from hemorrhage is countered by this method. This also helps in reduction in pain and swelling. When putting bandage, it is necessary to ask the patient regarding its tightness, elevation, and breast. The injured arm or foot should be kept at an elevated level to the height of the heart. This helps in reducing the blood pressure and blood seepage. The patient should take rest for some days based on the type of injury. Thus, you have learned about bones, joints, and soft tissue injuries. Due to some injuries, if a bone in the hand is broken, then it will show the following symptoms: pain, tenderness, swelling, discoloration, deformity, and inability to move. In such cases, do not move or straighten the hand, and keep it immobile in the same position. Tie a triangular cloth around the neck and the hand as shown in the animation. Then make it quickly to the nearby hospital for further treatment.
Duties of stakeholders.
Duties of shipper are to declare the nature and condition of carried goods, to select adequate packing, labeling and marking as per IMDG code, to effect a proper stowage and lashing of goods within the containers. Duties of forwarding agent are to check with the shipper that stowing and securing of goods in containers are in conformity with IMDG code and maritime requirements, to obtain approval of inland transport from local and national authorities, to draw up dangerous cargo manifest according to IMDG code, to control labeling of containers, to give instructions to stevedore and port authority and full documentation like shipper declaration, dangerous cargo manifest, etc. Duties of stevedore are to stack container in dangerous cargo terminal as a stacking area waiting for shipment, to obtain instructions like stowage and base plan from line operation center, to handle with care container to avoid bumps, shocks in order not to jeopardize securing of cargo. Duties of ship's manager are to check with the forwarding agent every units of dangerous goods, to obtain approval of loading from port authorities, to check the type of container is appropriate to carried goods, to build up ship's stowage in respect with IMDG segregation table of non-compatible stuffs, to instruct ship's staff accordingly. Duties of the ship's staff are to check containers lashing with the operation center prior to departure, to effect daily checking of container condition and lashing, to inform crew of the stowage plan regarding location of bays with dangerous cargo or hazardous cargo, to have a safety drill accordingly based on information on hazards incurred, chemical reactions to water, foam, carbon dioxide, heat-emitting dangerous gas, suffocating smoke, etc. To instruct when at K, port authorities and safety guards of the loading on board of dangerous goods like bunkers blazing at risk.
In this media, you will learn about the consequences of consuming poisonous materials. Inhaling poisonous gas or dust, skin absorption, swallowing of poisonous gas or fluid, and so on, come under intake of poisonous materials. Based on the type and the quantity of the material, the reaction differs. The poisonous materials first affect the brain cells and stop the oxygen flow. It results in unconsciousness, and sometimes it leads to death. Inhaling poisonous gases results in absorption of poisonous gas by the blood and affect the lungs, nose, and throat. Through skin absorption, the blood quickly absorbs the poisonous gases and fluids. If the poisonous gas or material is swallowed, the mucous membrane in the mouth absorbs it quickly. Thus, you have learnt about the consequences of consuming poisonous materials. In this media, you will learn about different injuries occurring to the eyes. In case of any LNG contact or spillage, the eyes are affected very much. The harmful exposure results in irritation, tears, and burns in the eyes. In case of such eye injuries, it is good to rinse the eyes with water, and then proper first aid measures must be followed. Thus, you have learnt about the eyes. This media shows us the methods of suturing techniques which can be used for dermal wounds or cuts. Here are the materials or surgical instruments which are required for the purpose of suturing. First, suturing needle. A forceps to hold on to the needle. A tissue forceps and scissors. Now, we can go on to interrupted suturing technique. We have dermal layer to be sutured. The needle and the suture are taken with the help of the forceps. First, the needle is punctured and a knot is made at one end of the wound. Then, another knot is made at the wound. This is an interrupted simple suturing method. Now, we can go on to continuous suturing technique. We have dermal layer to be sutured. First, take the needle and suture with the help of the forceps. Now, tie a knot at the start of the wounded area. Then, insert the needle onto next step, few millimeters, insert needle as you sew your clothes. At the end of the wound closures, now put another knot at the end of the process and cut the excess of suture. This media helps us to get a knowledge about intravenous line. There are things needed for starting intravenous drip. First, look at selecting an appropriate vein. Applying the tourniquet to impede venous return and engorge the vein. Cleanse the selected area completely with alcohol swab before the catheter insertion. Insert the catheter bevel up at around a 30-degree angle from the arm. Retract the needle and simultaneously remove the hub. Apply the sterile normal saline to the hub, and then put on a bandage to keep the hub in a stable position. Now, adjust the flow level of the normal saline. The media gives knowledge about the stages and effects of immersion. When the person falls into cold water, their body's initial reaction is a gasp reflex, which can include hyperventilation and muscle spasms. This initial reaction can result in water inhalation, as well as significant changes in heart rate and blood pressure. A person will lose the ability to swim, and hands quickly begin to lose strength and sensation subsequently. The person's overall body temperature will continue to drop until it has reached the same temperature as the water. Hypothermia symptoms range from mild to ruthless as the body's core temperature falls. A person will eventually lapse into unconsciousness. A drop in blood pressure, which may lead a person to become unconscious or to stop breathing at the point of rescue or up to several hours afterward. In this media, you will learn about frost injuries. The main cause of localized frost injury is negligent handling of cranes and pipelines carrying cold gases. The first symptom is pricking feeling on the top layer of the skin, followed by white spots on the skin. Use warm water to thaw frozen hands and feet. Do not rub or massage the frozen skin. Use soft wool fabrics to cover the frozen body parts. Thus, you have learned about frost injuries. The human immunodeficiency virus, with its various structures, is shown. The HIV recognizes the CD4 receptor of the host. It then attaches to the host cell with its GP120 glycoprotein. It injects its bipartite RNA into the host. Reverse transcription takes place in one of the RNA strands, and double-stranded DNA is produced. The DNA circularizes and enters the host nucleus. It then undergoes transcription and translation. The viral protein is synthesized. There is assembly of the virion in the cytoplasm. The HIV buds out as a whole organism without host lysis. ELISA is a biochemical technique used to test the presence of any antigen or antibody in a given sample. In direct ELISA, the first step is to coat the microtiter well with the primary antibody. Then, the sample suspected to contain the antigen is affixed on the surface of the primary antibody. To detect the antigen-bound antibody, an enzyme-coded secondary antibody is introduced which binds with the antigen suspected. Then, a substrate is introduced to detect the entire reaction. This is confirmed by the color change as the enzyme digests substrate. In indirect ELISA, the first step is to coat the well with antigen. It is then washed with the sample suspected to contain antibody. To detect the antigen-bound antibody, an enzyme-coded secondary antibody is introduced. This is bound with an enzyme which attaches to the constant region of the primary antibody. Finally, the substrate is added to the reaction mixture. The reaction is confirmed by the color change as the enzyme digests the substrate. DNA is the genetic material which is amplified by polymerase chain reaction. The reaction mixture contains DNA template, Taq polymerase, primer, and dNTPs, which is kept in a thermal cycler. The first step is the denaturation step, where the double-stranded DNA is broken into single-stranded DNA. The next step is annealing, which involves the attachment of the primer on both the strands. The last step is elongation of the newly formed complementary strand. This takes place with the enzyme Taq polymerase, which adds the complementary dNTPs from the reaction mixture. This happens in a similar fashion for the other single-stranded DNA. This continues for several cycles where the DNA is amplified into multiple copies. Entry inhibitors work by blocking the virus which have the ability to infect a cell. There are two general types of entry inhibitors: fusion inhibitors and attachment inhibitors. Reverse transcriptase inhibitors work by blocking reverse transcriptase's enzymatic function. It prevents completion of synthesis of the double-stranded viral DNA. Integrase inhibitors work by interfering with the integrase enzyme's activity. It's responsible for ensuring that HIV genetic materials are not integrating into the human genetic materials. Protease inhibitors work by blocking a protease enzymatic function. When protease is blocked, HIV makes copies of itself that can't infect new cells. Amphetamine is a stimulant and an appetite suppressant drug which people most commonly abused. The metabolic pathway of amphetamine drug is the effect of amphetamine is amphetamine is a stimulant and an appetite suppressant drug which people most commonly abused. The metabolic pathway of amphetamine drug is the effect of amphetamine is Anabolic steroids are legally prescribed drugs for the hormone deficiency. And it can also be used to build the skeletal muscles. The side effects of anabolic steroids are cocaine is a powerfully addictive stimulant drug. The chemical structure of cocaine is the adverse effects of cocaine are heroin is a highly addictive drug. The chemical structure of heroin is the side effects of heroin are shown. Marijuana is a common illicit drug used by some adolescents. The chemical structure of marijuana is the side effects of marijuana are shown. Morphine is a narcotic pain reliever drug. It is obtained from opium. The chemical structure of morphine is the adverse effects of morphine are Grading of obesity can be done based on body mass index, or BMI. If the body mass index is between 18.5 to 24.9, then it falls under normal weight. If the BMI is between 25 to 29.9, then it comes under overweight. BMI between 30 to 34.9, it falls under obese category. Severe obese has the BMI of 35 to 35.9. Morbidly obese has the BMI of over 40. In this, 1, 2, and 3 denotes grade 1, grade 2, and grade 3 obesity. Food pyramid indicates the essential foodstuffs to get adequate nutrition. It is advisable to take these foods based on a recommended number of servings. Foods at the bottom, like grains, have highest number of servings as well as nutrition. Food at the top, like chocolates and junk foods, are considered as non-essential and have fewest number of servings. Food at the middle should be taken in the recommended servings. The order of rows in the pyramid refers to the quantity of food consumed on a daily basis to get a nutritionally balanced diet. During puberty, the body of a girl develops into women. During this period, it's very difficult to accept these changes in the body. They develop psychological disorders such as anorexia nervosa and bulimia. Both the conditions are considered to be as mental disorders. And both the disease is related to low self-esteem. Anorexia nervosa is characterized by dramatic loss of weight, considering them as a fatty person. Bulimia is characteristic periods of binge eating, since they do not have control over food. Both the conditions undergo drastic dieting, exercising intensively, and self-induced vomiting. The purpose of this media is to have knowledge of the symptoms of bulimia disease and its effects. Here, a person always goes on a heavy diet in all times. Due to his excessive intake of food, he intends to produce a belly. The symptoms of bulimia are clear at this point. He has depression over his increase in size of belly. This intends him to go and vomit the food which he has intaken. The person does not stop with this, and he continues to vomit soon after taking food again. It is an administration of fluid to prevent or to correct dehydration. According to UNICEF formula, the oral rehydration therapy consists of 3.5 grams of sodium chloride, 2.5 grams of sodium bicarbonate, 1.5 grams of potassium chloride, and 20 grams of glucose. All the above salts are dissolved in 1 liter of drinking water. This mixture is administered through the oral route at frequent intervals to correct dehydration. The homemade oral rehydration solution is prepared in simple form. Take 1 liter of boiled water and wait for some time to get cooled. Now add 8 teaspoons of sugar and stir it well. Then add 1 teaspoon of salt and again stir it well. Now the oral rehydration solution is ready to drink.